Hi guys, so I sent an email with health proxy questions and the video isn't uploading, so the, the health proxy questions that one would ask a doctor is, what are the risks and benefits of the measures you're recommending, tests, treatment, life prolonging stuff? What will happen if it's not given, like the person will die, or maybe nothing, will it be painful? Something that seems to happen is people are on death's door and the hospital is still taking blood tests like every hour, so the person who's dying is being pricked every hour to get like blood tests, and the person's dying, so there's no need for that blood test, and for just this unnecessary pain and being disrupted, woken up, when somebody is ill or dying. So, if that should be my case, don't let them do that. I don't want them to take my blood and bother me if I'm dying. So, you would ask, what's the purpose of this blood test? Is it to cure this dying person, or is it to comfort them? Or is it to postpone death, or is it for some legal insurance purpose? Will it? So you would ask, will this treatment get her back to the way they were before they were in the hospital? Like, will this treatment restore them to original or optimal functioning? Will insurance pay for this treatment? If not, how much will it cost us? That'll stop it right there. It takes 3 months for them to figure that kind of thing out. Who's in charge coordinating my overall care? Is that a nurse or whomever? Would a second opinion about treatment be useful, or second opinion be useful for whatever reason? How long would it take for me to recuperate from the situation or from the treatment? What are the risks of treatment? What are the side effects of treatment? Are there other options, alternative to the treatment? Could the treatment be given at home? Are there other ways of handling a problem? What would you advise? So you would ask the doctor what would they do if this was their sister or their daughter. If there is medical terminology being used that didn't seem to make sense, or you don't know about, ask what the medical terms mean. You could also ask who in the hospital could help you understand the problem or the treatment. Do they have a palliative care staff? Palliative care is comfort care, so it's not necessarily there to cure, it's there to help people be comfortable in their medical process or their dying process. Is there a social worker there, a chaplain? Is there an ethics committee? A computer that you could use to look things up or contact people? A nurse manager of the department? And if there's doing blood tests, ask why are the tests being done and what do they show? So in order to obtain good care for me or whoever you might be finding yourself doing this for, it's good that we're preparing in advance. I'm sure this is so much fun for you guys, but so you learn what I want, or whoever you're helping wants in terms of their healthcare decision. And we're doing this before I lose my ability to decide. And this is about my values, my beliefs regarding living, quality of life, and a healthy dying, and my spiritual beliefs, apparently. So let's say you were my health proxy and it was, needed to be done. You would make yourself and your role as my health proxy, as my healthcare power of attorney, you'd make that known to the medical staff. So you would make sure that the advance directive, and it's probably going to be the 5 wishes. So you would make sure that this was in my medical records and that they were aware of it. You'd make sure that the medical personnel knows what this 5 wishes is, that it was my medical directive. And you'd want to keep a copy of it for yourself. So you could show the people involved in my care. And your job is to keep in touch with those people. So you would stay informed of my condition as it changed, um, and also members of the staff in the hospital change as well. So it'd be helpful if you find the person who would help you keep informed of my condition. And it's important to stay flexible and check the medical records every day. Oh my god. So you might have to push people to make somebody responsible for overall care. So it's like the right hand doesn't know what the left hand is doing, and it seems like not a lot of times do they want to take entire full responsibility for the general patient. So I guess it's like they don't have to. There's no accountability if there's nobody in charge. So you would have the glorious job of making sure this is possible. However, there is something called a care manager that is paid by insurance. So I do have Medicare. So um, so there could be a care manager that would that could possibly be employed through my insurance. So they would kind of be the hospital go-to person. So you would have legal authority to make medical decisions, even if, let's say, my crazy family did care enough to be involved. You guys would be in charge because you know what my wishes are. And it's good to try to have good communication. And you can ask for a patient representative or ombudsman, social worker, clergy, or spiritual advisor of the hospital. You could ask them to request that some sort of advisor comes. So in case you need to talk, in case my family was here and you needed somebody to work as a mediator. And so it's good to anticipate transfers. Apparently, patients can be moved from one section of the hospital or to an entirely different hospital altogether. So it's important to know, to be aware of that. And it's good to meet with where the patient is moved to make sure they're aware, the new place is aware of the new treatment. So you would be advocating on my behalf and asserting yourself with the medical team. I'm not even sure I could do this. But let me ask you guys. Anyways, so some medical people may not be as comfortable with others with you being involved. Doesn't that sound lovely? So you may disagree with the doctor's recommendations. And it's a hard thing to do with authority. So it's important to be tactful and assertive, insist that medical issues be explained to you in words you can understand. And if the doctor's resistance becomes a problem or you feel like you're not being heard, ask for help. So you can ask for help with the hospital's patient representative, the ombudsman, a social worker, clergy or spiritual advisor, ethics committee, or ethics consultants of the hospital. So apparently hospitals have all these things. And so there is that private care manager, and they can advise you if the care is deficient or inappropriate. So these guys, these care managers, care coordinators, they're paid by insurance, and they can be an RN, they might be a social worker, and looks like local hospices have stuff like that, like have people for that. So, oh my gosh. Well, what do you think? Thanks for watching. Bye.